Welcome, everyone. Thank you for joining us for today's webinar on medical review findings for individual psychotherapy. My name is Jennifer Boniface, and I am one of the registered nurses with the Provider Outreach and Education team. Today's webinar will focus on documentation requirements for individual psychotherapy. We'll also take a closer look at medical review findings related to this service. For additional details about individual psychotherapy, including local coverage determination requirements, please watch our encore presentation titled Individual Psychotherapy, and that encore was recorded in January of this year. The presentation is available on our YouTube channel, and we'll also share a link to this encore recording in the chat, and you can also find it on the resources slide at the end of the presentation. Psychotherapy, as defined by Local Coverage Determination L34616 for Psychiatry and Psychology Services, is a professional therapeutic approach in which a clinician develops a structured relationship with a client to address mental health and behavioral challenges. Individual psychotherapy is a one-on-one therapeutic service provided by a qualified mental health clinician to a single client for the purpose of assessment, diagnosis, and treatment of mental, emotional, or behavioral disorders. Through individual sessions in a confidential, supportive setting, the clinician works with the client to manage emotional distress, change maladaptive behaviors, build resilience, and improve daily functioning and overall mental well-being. Today, our objective is to discuss the coverage criteria, documentation requirements, and medical review findings for individual psychotherapy. So we'll begin with an overview of the individual psychotherapy codes and coverage, followed by a review of documentation requirements. Next, we'll discuss the most common recent code applied during medical reviews. Finally, for individual psychotherapy. Let's start with a quick overview of the codes used for individual psychotherapy. In mental health settings, providers use CPT codes to represent the length and type of psychotherapy services delivered during a session. Each code corresponds with a specific time range, helping ensure that the service provided is accurately documented and billed. The CPT codes for individual psychotherapy between a licensed mental health provider and the client include 90832, 90834, and 90837. 90832 is used for shorter sessions. Although often called a 30-minute session, it actually applies to visits lasting 16 to 37 minutes. It is typically used for brief check-ins, focused interventions, or follow-ups when longer sessions are not clinically necessary. 90834 applies to sessions lasting 38 to 52 minutes, which is generally considered a standard 45-minute session. 90837 is used for longer sessions lasting 53 minutes or more. They are often referred to as a 60-minute session. These extended sessions are typically reserved for more complex or intensive therapeutic needs that the shorter sessions cannot fully address. Longer sessions are particularly appropriate when a client is dealing with severe anxiety or major depressive episodes, complex mental health conditions such as bipolar disorder or post-traumatic stress disorder, or situations requiring exploration of complex emotions and thoughts that cannot be effectively managed in shorter sessions, such as trauma recovery or interventions for personality disorders. These codes are applicable as long as the service aligns with the approved clinical and billing practices. It's also worth noting that, according to Medicare guidelines, individual psychotherapy must be medically necessary and designed to address each client's unique needs. The frequency, type, and length of therapy are determined by the client's mental health condition and treatment goals. When providing individual psychotherapy, billing is based on the length or duration of the session. Sessions that last less than 16 minutes should not be reported. Medicare requires clinicians to clearly record the length of each session, including the exact start and end times, or the total time spent in direct therapeutic interaction, and to ensure this information is accurately documented in the client's medical record. This documentation should be based on the actual services provided, with billing limited to the time spent delivering psychotherapy. For individual psychotherapy sessions where no other evaluation and management service is provided, CPT codes 90832, 90834, and 90837 are used. However, if individual psychotherapy occurs alongside a separate E&M service, the appropriate code is either 90833, 90836, or 90838, depending on the duration of the psychotherapy session. Using these codes correctly not only ensure accurate billing, but also keep your documentation compliant with Medicare requirements. And we received two pre-submitted questions regarding providing both individual psychotherapy and evaluation and management services, so I want to address them before we proceed. The first question asks, when a provider furnishes both evaluation and management and psychotherapy services, does the documentation need to be separate and distinct, or can the documentation be combined? The E&M and psychotherapy services may be documented in the same clinical note. However, the documentation must clearly distinguish and separately support each service as medically necessary. The time spent providing psychotherapy should also be clearly documented, either by start and stop times or by documenting the total psychotherapy time in minutes. Additionally, the psychotherapy time should not include time attributable to the E&M service. The next question asks whether the same documentation requirements apply when the provider performs the individual psychotherapy alongside an E&M visit. When psychotherapy services are billed with an E&M service by a qualified physician or qualified mental health provider, the medical record must support that both services were medically necessary, separately identifiable, and appropriately documented. The documentation must support the requirements of the evaluation management service and the psychotherapy service individually. The E&M portion should comply with applicable E&M documentation requirements, including appropriate medical decision-making or time-based requirements if they apply. The psychotherapy portion should meet applicable psychotherapy documentation requirements, including psychotherapy intervention, clinical focus, psychotherapy time, patient response or progress, and medical necessity for continued treatment. Psychotherapy documentation requirements apply whether psychotherapy is billed independently or as an add-on code to E&M. The documentation should clearly distinguish the E&M services from the psychotherapy services and demonstrate that each service was independently supported. For individual psychotherapy services, there are specific Medicare criteria that need to be met. Those requirements are outlined in both the Medicare Benefit Policy Manual, Chapter 6, Section 70.1A, and MLN 198-6542, Medicare and Mental Health Coverage. First, an individualized treatment plan is required. Services need to be prescribed by a physician or clinician eligible to furnish this service under Medicare and be based on an individualized written plan of treatment. This plan is created after consultation with appropriate clinical staff. It should clearly specify the type of services, how often they will be provided, the expected duration of treatment, the client's diagnoses, and the anticipated goals. A plan is not required if only a small number of brief services are provided. Medicare requires that the treatment plan be reviewed and updated periodically and whenever there are significant changes in the client's condition or treatment goals. This ensures progress is documented, services remain justified, and therapy continues to be medically necessary. Next is the physician supervision and evaluation services. A physician or Medicare qualified clinician must actively supervise the treatment and regularly evaluate whether the client's goals are being achieved. This includes reviewing medical records, communicating with therapists, and meeting with the client. The provider's active involvement should be clearly documented in the medical record. Additionally, the provider should guide and supervise any therapist involved in the client's treatment, check in periodically to review and evaluate progress, and make adjustments to the treatment plan as needed to ensure the goals are being effectively met. Finally, there must be a reasonable expectation of improvement. Services should either be intended for diagnostic purposes or be reasonably expected to improve the client's condition. At a minimum, treatment should strive to reduce or control psychiatric symptoms, prevent relapse or hospitalization, and maintain or enhance the client's overall functioning. Improvement doesn't necessarily mean returning the client to their exact pre-illness level of functioning, though that may be the goal for some. For many clients, especially those with long-term or chronic conditions, the goal is to manage symptoms and prevent further decline, an approach that is considered a reasonable expectation of improvement. Improvement is also measured by what might happen if treatment stops. If discontinuing care is likely to lead to decline, relapse, or increased hospitalization risk, ongoing treatment can still be considered medically necessary. Some clients may stabilize and reach a point where further significant improvement is unlikely. However, this does not automatically mean treatment is no longer covered. Coverage is determined by whether the medical necessity criteria are still being met. Once a client can maintain stability without further treatment or with less intensive care, the services are no longer considered medically necessary and would not be covered. Now, let's talk about the documentation needed to support psychotherapy services and to demonstrate that the treatment provided is clinically appropriate and justified. The first element is documentation of a covered diagnosis. The medical record should include a diagnosis that clearly supports the need for individual psychotherapy. It should show that the client has a psychiatric condition or emotional or behavioral symptoms that significantly affect their daily functioning. This is required to demonstrate and support the medical necessity of the therapy. Next is documentation from the individual psychotherapy session. Each session should have a detailed summary covering the time spent with the client, therapeutic interventions used, the client's response, their level of engagement, any progress or setbacks in symptoms or behavior, and progress toward treatment goals. Documentation from individual psychotherapy sessions should include, but is not limited to, topics discussed during the session, details of interventions or activities delivered, the benefits of the therapy, including anticipated outcomes and improvements in the client's health and daily functioning, functional status, including how the client's mental health affects daily life, such as self care, emotional regulation, work or school performance, relationships, and overall well being, the client's capacity to engage in and benefit from the session, and periodic summaries of the treatment goals, progress achieved toward those goals, and any necessary updates to the treatment plan. The documentation from the session must support the code and actual minutes billed. Finally, all notes must be dated, signed, and include the clinician's credentials. The third element is documentation of the treatment plan. Treatment plans should be reviewed and updated periodically to accurately reflect progress toward treatment goals, the anticipated length of the therapy, targeted symptoms, and any adjustments to the treatment approach, whether behavioral, cognitive, or pharmacological. It's also essential to document therapeutic techniques such as behavior modification or supportive interactions to show how they contribute to therapeutic change. Keep in mind that behavior modification is not billed as a separate service, but rather serves as a complement to the psychotherapy. A comprehensive treatment plan typically includes presenting issues and diagnoses, target symptoms, clearly defined treatment goals, the interventions that will be used during the sessions, methods for monitoring progress toward those goals, a rationale why the chosen psychotherapy approach is appropriate, the estimated duration of treatment or total number of sessions, and a plan for addressing potential challenges that may arise. The treatment plan must also be signed by the clinician. And before we move on, I want to address another pre-submitted question we received. The question asks if the treatment plan has to be on a separate document from the therapy notes, or if they can both be on the same progress notes. And the treatment plan does not need to be separate if it is identified clearly within the progress note and includes all the required elements. The fourth element is documentation to support medical necessity. To support the medical necessity of individual psychotherapy, documentation should clearly show that the client is actually benefiting from the therapy, whether that's improvement in their symptoms, active participation during sessions, or progress toward their treatment goals. This documentation should be included in the medical record so it clearly justifies why treatment should continue. For prolonged treatment, the documentation should support not only the medical necessity of the treatment, but also show why continued treatment is still clinically appropriate. That includes knowing the client's ability to engage in therapy and confirming the treatment approach being used is the right fit for them. If billing for interactive complexity, documentation must explain why standard communication methods weren't effective. Be sure to describe the adjustments made during the session, along with the rationale and any recommendations for future care. Also, keep in mind that this list is not exhaustive. Depending on the situation, providers may need to send in additional documentation to fully support the claim. And finally, be sure to include a advanced beneficiary notice of non-coverage if it applies. The ABN helps beneficiaries understand ahead of time if a service might not be covered by Medicare, so there's no surprises when it comes to cost. If documentation is incomplete or missing, it can lead to denials. That's why it's so important to ensure documentation is thorough, accurate, and up to date, not just for compliance, but also to support continuity of care and ensure proper reimbursement. Before we dive into claim examples, let's take a moment to review the denial reason code we see most frequently in individual psychotherapy documentation. Understanding this code will help you identify trends, address recurring issues, and improve the overall quality of your documentation. A link to the reason statement and document codes can be found at the bottom of the slide. The most common denial reason code we encounter for individual psychotherapy documentation is GBC01. This code indicates that the documentation submitted does not support medical necessity as listed in coverage requirements in the National Coverage Determination or Local Coverage Determination. This often happens when clinical records lack enough detail or do not fully align with the diagnosis or treatment guidelines. To address this, it's important to carefully review the applicable LCD for psychotherapy and ensure your documentation clearly establishes the medical necessity of the service rendered. Documentation should include comprehensive clinical notes, relevant assessments, and a treatment plan that adheres to the prescribed guidelines. Remember, to minimize denials, all required documentation must be accurate, complete, and submitted within the designated time frame. Now that we've covered the requirements for individual psychotherapy, let's review a few claim examples. We'll examine two claims that include all the required documentation and one that's missing documentation. Our first example is claim number 1, with a date of service of January 29th, 2026. For this claim, all documentation requirements for CPT code 90837 individual psychotherapy were met. Now let's go through the documentation sent by the provider, and I'll point out some key findings within the chart. So on page 1, we can see the individual psychotherapy note for the date of service of January 29th, 2026. The session duration is documented as 60 minutes. The service code is listed as 90837 for individual psychotherapy, and the participant is noted as client only. The client's diagnosis is major depressive disorder, recurrent moderate. The diagnostic justification reports that she meets the key requirements for this diagnosis. She is oriented ×3 to person, place, and time. Her mood is described as anxious with an appropriate affect. Her insight, judgment, and impulse control are noted as good. Her memory is intact and her functional status is intact. Now let's scroll to the bottom of the note and review the provider's documentation in the subjective report and symptom description section. The client is described as having concerns related to family dynamics. Next, in the objective content section, we see the treatments provided during the session include cognitive behavioral therapy, specifically cognitive reframing, as well as exploration of emotions, relationship patterns, and coping strategies. The note indicates that the client responded to these interventions by actively participating in the session. Her affect is documented as appropriate, and she is noted to have anxiety, which is consistent with her reported concerns regarding family members. The provider also documents that the 60-minute session length was justified due to the complexity of the issues addressed and the therapeutic techniques used during the session. Under interventions used, the provider lists the specific techniques applied. These include cognitive reframing, exploration of coping patterns, exploration of emotions, exploration of relationship patterns, mindfulness training, and supportive reflection. On page 2, under the treatment progress section, the documentation shows that the client reports a decrease in depressive symptoms and is making progress toward her treatment goals. The assessment note further indicates the client is able to reflect on her feelings and actively engage in therapeutic interventions. She's also making progress in identifying her emotional stressors and understands the impact these stressors have on her relationships. The provider states that continued therapy is necessary to further develop coping strategies. It's also noted that the medical necessity is supported by the client's diagnosis and her ongoing difficulty managing emotional responses related to family dynamics. The provider adds that the client's prognosis is favorable as long as she remains consistent with treatment engagement. The treatment plan outlines the client will continue with weekly therapy sessions with a focus on exploring and reframing cognitive distortions. Future sessions are expected to concentrate on developing coping strategies. At the bottom of the page, the provider attests that the note is accurate and complete. The documentation includes the provider's electronic signature along with the date and time, confirming proper authentication of the record. So after reviewing the claim, it was confirmed that the submitted medical record included all the required documentation for CPT code 90837 individual psychotherapy for this date of service. The claim was then cleared for payment processing, pending any additional system edits. Our next example is claim number 2 with a date of service of January 22nd, 2026. Similar to the previous claim, this claim meets all the documentation requirements for CPT code 90837. So we're now going to take a closer look at this claim and review the documentation sent. So on page 1, we can see the clinical note for the date of service of January 22nd, 2026. The session start time and end time are clearly documented, reflecting a total duration of 55 minutes. The note indicates that the session took place between the client and the provider. The client's affect is described as euthymic, while her mood is noted as better, frustrated, angry, and tired. Her thought processes and speech are reported to be within normal limits, and she denies any suicidal or assaultive ideations. In the section on reported changes in circumstances or medications, the documentation highlights that the client gained good insight, learned from what happened, and was able to reach a sense of resolution or closure. Additionally, under the treatment modality section, it is noted that she made excellent progress addressing the week's issues through cognitive behavioral therapy. The provider confirms that the documentation supports the medical necessity of the service. At the bottom of the page, the provider has signed and dated the note. On page 2, we can see the individual psychotherapy note for the date of service of January 22nd, 2026. The client's diagnoses are listed as major depressive disorder, alcohol use disorder, post-traumatic stress disorder, and prolonged grief disorder. The session start and end time are documented with a total duration of 55 minutes. During the session, the client expressed concerns about feeling pressured to make decisions without fully considering the facts or potential consequences. She reports that she has not consumed alcohol that day. Her thought process is documented as rational and non-repetitive, and she exhibits fewer signs of stress. Under therapeutic interventions, the note indicates the client received cognitive behavioral therapy along with brief crisis intervention. The note also highlights that the client remains sober, responds rationally, and is able to distinguish between how situations occurred versus how ideally should have occurred. In the medical necessity section, the provider indicates the client is making progress with treatment. The plan is to continue with the treatment plan as the therapy is working. Finally, the note concludes with the provider's signature and date at the bottom of the page. On the last page, you'll find the treatment plan. It outlines the client's concerns as well as her short-term and long-term goals. The plan is signed and dated by the provider on January 21st, 2026. Again, after reviewing the claim, it was determined that the submitted medical record include all required documentation for CPT code 90837 individual psychotherapy for this date of service. The claim was then cleared for payment processing pending any additional system edits. Our last example is claim number 3. The date of service for this claim is January 13th, 2026. For this claim, the documentation is missing a periodic summary of goals, updated progress toward goals, and an updated treatment plan. So let's open the claim now and review what the provider submitted. So on page 1, we have the individual psychotherapy note for the date of service of January 13th, 2026. At the top of the page, the note is electronically signed and dated by the provider. The session's start time and end time are recorded, reflecting a total duration of 55 minutes. The session type is marked as individual, and the chief complaint is documented as CPT code 90837. The client reported a decrease in anxiety and depression. The treatment intervention consists of talk therapy. Her mood is noted as content, and her affect is normal. The documentation also reports no suicidal or homicidal thoughts are present. Now let's review the details in the assessment section. The client's diagnosis is listed as major depressive disorder, recurrent, severe, with psychotic symptoms. According to the progress section, she reports volunteering at her church and making new friends. She also shares that she has started setting boundaries with her family and feels pleased with this progress. Additionally, the client has resumed reading a book on codependency, and her assignment for this session is to continue reading it. On page 2, the note is electronically signed, dated, and timed by the provider, ensuring proper authentication. The last page contains the client's treatment plan, outlining the expected outcomes along with short-term goals and objectives. These short-term goals focus on decreasing depressive symptoms, decreasing codependency, and increasing social activity. At the bottom of the page, treatment plan is signed and dated by the provider. Now, while the documentation shows periodic reviews of the treatment plan and goals, there is a gap of over 8 months between reviews, even though the plan specifies that reviews should be completed every 90 days. In respect to the date of service for this claim of January 13th, 2026, the treatment plan was reviewed on June 9th, 2025, and then not again until February 16th, 2026. Now, let's discuss why this claim was denied. While the documentation included many of the required elements, it was missing several key updates: a periodic summary of the goals, updated progress toward those goals, and an updated treatment plan. Although a treatment plan was present, the goals had not been updated in over 8 months. The treatment plan also states that the reviews are to be completed every 90 days. For Medicare psychotherapy services, the treatment plan must be updated regularly to document progress, adjust treatment as needed, and support ongoing medical necessity. According to the Medicare Benefit Policy Manual, Chapter 6, Section 70.1a, the physician must see the client periodically to evaluate the course of treatment and determine the extent to which treatment goals are being realized, whether changes in direction or emphasis are needed. It's essential for reviewers to see that clinicians are tracking and recording progress, as this shows whether the treatment is working and whether any modifications are needed based on the client's response. Since this documentation didn't provide evidence of ongoing updates and progress, the claim was denied. Individual psychotherapy is a one-on-one form of therapy between a client and a licensed mental health clinician. It is designed to assess and treat emotional, behavioral, and mental health concerns using therapeutic approaches that support the client's ability to function better and improve their overall quality of life. These services must be medically necessary and focused on improving, maintaining, or preventing a decline in the client's mental health and daily functioning. Treatment should use clinically recognized therapeutic methods that are appropriate for the client's needs. So as a recap, during today's webinar, we provide an overview of individual psychotherapy codes and coverage, discuss documentation requirements for individual psychotherapy, cover the most common denial reason code we encounter during medical review related to documentation, and reviewed claim examples for individual psychotherapy. This slide contains several resources with links to information covered today. These include LCD L34616, Psychiatry and Psychology Services, a WPS article on individual psychotherapy, the Encore presentation on individual psychotherapy, and the mental health playlist available on our YouTube channel. Please use this slide as a reference when reviewing the presentation. The Centers for Medicare and Medicaid Services, in collaboration with the DME National Provider Enrollment East contractor, will host the annual National Provider Enrollment Conference. The purpose of the conference is to educate the provider and supplier community on multiple aspects of provider enrollment. These events represent the largest gathering of providers and suppliers and allow CMS the opportunity to address a large, diverse group and greatly enhance our provider enrollment efforts. CMS, Medicare Administrative Contractors, and MPE staff will be responsible for co-presenting topics. CMS will coordinate with the contractors on the sessions. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat feature and select Send to all panelists. If you don't get your questions today during the presentation, we will follow up with you after the webinar. So first, I want to address two pre-submitted questions we received. The first question asks whether a physician's existing treatment plan is sufficient for psychotherapy services or whether a separate plan needs to be developed for the psychotherapy services. Even if a physician has already established a treatment plan for a patient's medical condition, Medicare psychotherapy coverage generally still requires a separate, distinct treatment plan for the psychotherapy services. While the physician's plan may address medical aspects like medication management or physical health, the mental health clinician still needs to develop and document a separate plan addressing mental health needs, including treatment goals, therapeutic interventions, and measurable progress specific to the psychotherapy being provided. This is important for Medicare compliance because psychotherapy services must be medically necessary, appropriately documented, and supported for reimbursement. Although the two treatment plans can and should be coordinated, they should remain distinct with each addressing their respective areas of care. The other question asked, under Medicare, can a client receive both individual psychotherapy and group psychotherapy on the same day, or is billing limited to only one psychotherapy session per day? Under Medicare, you may bill both individual psychotherapy and group psychotherapy for the same client on the same day, as long as the services are medically necessary, provided at separate times, and documented as different therapeutic encounters. Documentation in the medical record should support that the medical necessity of both services, confirm the sessions occurred at separate times, describe distinct clinical goals and interventions, and show how each service fits in the client's individualized treatment plan. If applicable, use the appropriate modifier to indicate the services were separate and distinct, supporting Medicare billing requirements. So now I'm just going to take a look real quickly in the chat. And Mary Sue, do we have any questions? I'm taking a quick look and I'm seeing that they have been answered. So Mary Sue, do we have any additional?
Oh, I'm sorry, Jennifer. I have one outstanding question that I don't know offhand. And the question comes in and it was about the 90837. I'm wondering if it is denying automatically. The 90837 is the individual 60-minute psychotherapy session. for medical necessity, and they go on to ask should a progress note be submitted with the initial or original claim. And so I was working with this provider to figure out, if they're actively getting denials, and the place of service, if that is a face-to-face office or telehealth setting. It shouldn't be denying automatically if it is billed appropriately. Would you agree?
Yes, I would agree on that. Perhaps afterwards we could probably go after the webinar, maybe take a look a little further on that one, dig a little deeper, but it shouldn't be denying if you're appropriately documenting. Kaylee, can you do you agree with that?
Yes, I agree. And I can see on the initial submission, you can submit all of the needed documentation and you don't have to wait for those denials. So if you get that request and send all those notes in firsthand, and then we won't end up with those GBC01 denials.
Thank you so much, Kaylee. That was very helpful. So it does look like we're approaching the end of the webinar, and I do not believe you have any other questions, Mary Sue. Outstanding. Would I be correct?
I do not. There's some specific billing questions people ask, and they have been answered in the chat.
Okay, thank you, Mary Sue and Kaylee, for your help. So we are going to go on and finish up this webinar. Please take a moment to complete the survey and share your feedback. And we use your feedback to develop topics for future education events. And you can access the survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. And again, you'll get a pop-up that looks like this right here with that little yellow triangle, and that's not spam. That is redirecting you to that CMS Qualtrics page for the survey. In a few minutes, you'll receive an email which includes your certificate of achievement and a link to provide feedback. If you need contact hours for continuing education, they'll also be in that email. If you don't see it, check your spam folder. If you joined by phone, please email us at wps.gha.education@wpsic.com with the webinar name and the phone number you used to call in, and we'll make sure you receive that email. And included in that email will be a copy of today's presentation. If you can think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox, again at that email address, wps.gha.education@wpsic.com, and put the title of this webinar in the subject line. However, if you have claim-specific questions, please direct those questions to our customer service department, as we don't have access to your claim information and are therefore unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. Finally, on behalf of myself, Mary Sue, Kaylee, and all of Provider Outreach and Education, thank you for attending today's webinar on medical review findings for individual psychotherapy. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. And then as another reminder, for more information on individual psychotherapy, as well as other mental health topics, be sure to visit our YouTube channel and check out the mental health playlist. And a link has been placed on the resources slide of this presentation for you to click to go to that playlist. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.